The next mode of treatment for acute coronary syndrome that we'll be looking at is what is known as what? Reperfusion. Now, reperfusion is more of like, okay, there was like deposition of fat in the walls of the artery. So because there was deposition of fat in the walls of the artery, it led to narrowing the pathway in which blood is supposed to flow. You get it? So sometimes this blood can actually clot along the small pathway because the space is too small. You get? So reperfusion therapy is more of like what? You are giving some drugs or you are giving some treatment that will basically what? Try to break down the clot that has formed. Okay? So you call this reperfusion therapy or thrombolysis medication for acute coronary syndrome. So let's have the overview. We'll look at the types, the indications. That's when you should start giving such a treatment to the patient. The benefits, the contraindications, the complications, the medications used in what? Thrombolytic therapy and all of that. Alright, so reperfusion therapy is also known as what? Thrombolysis. It is a medical treatment used to what? Restore blood flow to the heart muscles because what? If there is blockage of the pathway for blood, the heart muscles are suffering. Other muscles too are suffering, do you understand? But you want to now attend to the heart muscles first because you don't want heart failure. Alright? So okay, so such as heart attacks. So the types of reperfusion therapy include thrombolytic therapy, which uses medication to dissolve clots. Then we have primary percutaneous or coronary intervention, which are using a catheter to open blocked arteries and restore the blood flow back to the heart. Okay. Then we have the ST segment elevation myocardial infarction. Okay, indications now. Indications like when to start this type of therapy. If there's an ST segment elevation myocardial infarction, it is a non-ST segment elevation myocardial infarction. If there's unstable angina, you might want to initiate all of this. Benefits: it will reduce mortality, reduce if possibly the patient was supposed to die. Okay. It will minimize cardiac damage. It will improve cardiac function. It will enhance the quality of life. The contraindication: if the patient is still actively bleeding or if there's a high risk of bleeding, you might not want to give the thrombolytic therapy. Why? Because thrombolytic therapy will generally make the heart, it will generally make blood in the body clot very slowly. So if they are bleeding now, it will now lead to what? Bleeding. You get too much bleeding, too much blood loss, right? If the patient has a recent stroke or head trauma, you should chill first. If there's severe hypertension, you might want to resuscitate the patient and calm them down first. If they have known bleeding disorders like hemophilia, you might want to calm down first, right? So complications. Even as you are giving thrombolytic therapy to help the patient, it can lead to what? Bleeding. Because generally what? The blood will not be clotting fast again, right? Then it could lead to allergic reactions, cardiac arrhythmias, re-occlusion of the artery later, okay? So medications that could be used in thrombolytic therapy include tissue plasminogen activator, streptokinase, red please, tenecteplase, and all of that, right? So what is the timing of reperfusion therapy? Ideally within 90 minutes of symptom onset, you should do that. So up to 12 hours after symptom onset for thrombolytic therapy, okay? Then primary percutaneous surgery can be what? Performed upon 24 hours after the symptom onset. Okay. So I think that's it for reperfusion therapy and thrombolysis medication for acute coronary syndrome.